Hi, I'm Dr. Tammy Lee. I'm a general surgeon with Surgery Associates of Houston at Baylor St. Luke's Medical Group. When we have a hernia and we fix the hernia open, we have to make a cut over where the hernia is. And then if you have to go through a large layer of subcutaneous tissue to get to the defect, there's healing issues, especially with diabetes or smoking or other vascular issues. With robotics, we have the ability to make small cuts and go in, and the robot, unlike laparoscopic, has the articulation of the robotic instruments. So it's more like your own hands when you're sewing, and you can repair the defect with little holes that heal much easier than a big cut. So when it comes to robotic surgery, I tailor it to the patient. But we take out colon cancers with the robot, we do gallbladders at times, but mostly I use it for hernia repair. And it's more magnified, so fine work, it's easier to do.